Hello, and welcome to the International Critical Incident Stress Foundation CISM Live series. My name is Kelly, and I'll be your host for today's discussion. Today, we're joined by guest speaker, Patty Stewart McCord. Patty Stewart McCord is a ICISF faculty member and the Canadian representative for ICISF on the board of directors. She is an author, international speaker, and consultant in crisis management services, and facilitates a number of ICISF certified courses throughout North America. She has led the development of peer support teams trained in CISM skills throughout the country, but more recently within ministries and government agencies in Saskatchewan. She is currently contracted with Saskatchewan Health Authority to provide training, team development, and support for the Provincial Health Authority Psychosocial Support Network, and is the executive director for the Saskatchewan CISM Network. Welcome, Patty.
Thank you. It's nice to be here.
We are currently looking to improve our CISM Live series in 2022 and make it even better for you, our viewers. If you have a few minutes, please click on the link in the description below and fill out the survey and let us know what topics you'd like to see discussed next year. Today, we're actually going to be discussing with Patty, filling the gaps in peer support. So Patty, what gaps are common in organizations that provide peer support?
Well, first of all, I think it's important to look at the intention that people have when they begin a team, when they decide that this is what they want to do. Quite often it is because of an incident, or it might be because of the need that they see within their organization. And there are a few things that I see that have to be really top of mind when we talk about how you build this so that there aren't gaps. So the first would be having the people resources. So enough team members so that if something were to happen, not everyone on the same shift is all on the team, so that if that shift is affected, then your team can't respond. So making sure that you sort those out and have people from different shifts, if you're that kind of an organization, who are skilled in doing this. The second thing has to do with the people that you choose. And every organization is different. But one of the things that I suggest from our experience is a nomination process rather than just having everybody raise their hand, because it gives others an opportunity to say, well, this individual is someone I trust, and this is someone that our organization would talk to, or this is someone who can take the ball and go with it, can help us build a program. So really having those people in place before you start. The next thing has to do with funding. It costs a bit of money in order to have your team trained, but it's also something you want to have annually so that you have funds available to do refreshers and ongoing training and support for your team so that they can get very skilled at what they do and they're confident in their response. And then the last thing has to do with practice, to bring people together in some way or another over the timeline of a year, for example, in order to be able to provide training and resources so that they, again, can build their skills. So those are some of the gaps that I see. The other part of that has to do with whether or not your organization has buy-in from the top. And that's important too, because there may be times along the way where you need that extra support or that extra muscle, shall we say, in order to be sure that you have the resources that you need. And so it's important to have that support as well.
Wow, that's amazing. So tell me a little bit about how did the Saskatchewan CISM Network come about originally?
Well, I've been doing this for a long time, and over the last 21, 22 years, I've been in Canada. I immigrated from the United States when I married in 2000, and married a firefighter, by the way. He's retired now. But in this time, I did a lot of training with government agencies, with communities, with volunteer groups, and they didn't know each other, of course. And so over the many years, I would often see situations where it would occur to me that if this group knew this group, they could work together in this situation because the skills are the same and they're very adaptable in different situations. And so that was the first thing. The second thing had to do with uh, events that have happened in our province. We've had two large scale, what we would qualify as mass casualty events over the last 5, 6 years. One was the school shooting in a very northern community where there weren't a lot of resources. And the other one was just a couple of years ago, the Humboldt Broncos junior hockey team bus crash. And in each of those, there were so many opportunities to provide critical incident stress management support, but not a lot of collaboration between organizations. And each one of those I was involved with on a number of different levels, but one of the things that I always notice is who could have helped here if we'd had that relationship ahead of time. When I train teams, I often say you got to play in the sandbox before the game ever starts, or else you're going to have trouble figuring out who's in charge and what to do when something happens. And so certainly this was highlighted by these events because there were a lot of well-meaning people, but not a coordinated effort with all of them. And the other part of that was there was no standard for training for all the people that showed up. And so you might have one group that's, and they could be very well qualified, but they may be trained in a different skill set. They may be mental health professionals, but no peers. Then there may be peers that took training 3 or 4 years ago, but they haven't had anything to upgrade since. So we wanted to be sure that anything that we were involved with would have a standardized training, would have instructors who are following the fidelity of the model, would have some sort of coordinated effort and a network relationship so that if one group was shorthanded, you could reach out to another group. And we found that there really wasn't any structure like that in this province. And so that's when we decided, a few of us got together and said, well, let's do this thing. And it's been very, very positive as far as an experience, but it has also created some really great opportunities for groups to work together.
Well, that's incredible. I'm so happy and so excited for you guys as you continue to work within the CISM network. So tell me a little bit about how the Saskatchewan CISM network works on a regular basis.
Okay. Well, we have a core group of team members. They are EMS, fire, police, both volunteer and municipal fire departments. And we have responded in rural settings quite often because those are the groups, especially in our province, volunteer firefighters and volunteer first responders have historically not had a great deal of support. So our first effort was to make sure that that was covered as well. And so we work with other teams too, in order to be sure that the coverage that they have is appropriate and accurately utilized in a way that everybody gets what they need. We also developed relationships, and in some ways it became a collaboration. And so now we have, for example, if something happens within, well, several years ago in one of the municipal fire or police departments, rather, there was a death of a colleague who was also on the CISM team. And so they were not able to, their team was not able to provide support for the department. So they contacted me, and I'm their trainer, but I'm also someone who coordinates through the network. And so what I did was contact Saskatoon Police Department, and between us, we responded and provided the critical incident stress management response with their mental health professional, and did all the work with all the shifts over the course of about a week. Another example would be in another setting, well, in particular, with the Humboldt Broncos bus crash. I coordinated the team that provided support for the rural settings, the rural fire and EMS and such. But when you look at the magnitude of an event like that, that affected 3 hospitals, life flight, STARS helicopter medical transport, hospital staff, emergency departments, surgical departments, ICUs, all of those different groups, and how it had a national lens on it because it got so much media attention. It had a national lens on it. And there were people that were trying to be sure that they were available, but we also wanted to make sure that the teams that were brought in the proper fit, but also the proper training. And so there were times where we had an opportunity, because of the relationship we'd built over the past years with government agencies, to be able to say, this group will be really helpful, this group not so much. And so we were able to, in some ways, protect those folks that were affected from having outside resources come in that wouldn't be a good match and fit for what they needed. In all of that, that's one of the things that we use as a learning opportunity. We now have a way of working together in a collaborative way with a number of different organizations. And we also provide training and resources when there's a need. And part of that too is being able to bring in resources from one organization and kind of meld it with something else, so that what we offer to the general population of people who do CISM within our province is the highest standard, the highest standard. We now have mental health professionals who are psychologists and master's level social workers who work with us also on volunteer basis, because our whole team is a volunteer group. And these therapists have been wonderful and very, very generous with their time as well to provide that support and the resource as well. So it really has been a collaborative effort that has grown out of that need, but a number of different things have grown from there. And I think the other thing that that I've talked about earlier, or I will talk about too, has to do with funding and making sure that you have those relationships built so that people are looking after those needs too, because an organization can't function, even a volunteer group can't function entirely on good intentions. So there needs to be some way to fund some of those resources so that you can carry on the work.
So should a network such as this work within a government structure or completely outside of the organizations?
That's a tough call. I think in some provinces in Canada, there's a coordinated effort between government agencies, ministries, and volunteer groups. I think in the United States, probably the same. Some organizations have a structured team within their organization, and they have that committed, dedicated fund and the dedicated manpower and womanpower in order to see it through. The thing that is important to consider here is you have to look at the sustainability of a program. And if it's vulnerable to a government cut, for example, where the funding is cut because of the nature of the situations that people are faced with, or up here, sometimes we see a shift in responsibilities. We call it a portfolio. So portfolio shifts from one organization to another, but the organization that it shifts to may not have the same commitment or the same kind of understanding of what the programs are. So those are things that are important to consider too. So within structured groups, you just need to be sure that you have that level of support from the top in order to make sure that the program is sustained. For us, because we have been watching this within our province for over 20 years, we realized that if we created an organization that was completely standalone, we are a charitable organization that's completely standalone, we can pilot our own ship, basically. We have a board of directors that's very committed to the work. We have psychologists on our advisory council and people that are involved in our just the day-to-day development of things now within our organization that commit the time, but have an incredible amount of information and resources based on their own experiences. And so we work in a collaborative way with the Canadian Institute of Public Safety Research and Treatment here at the University of Regina. We also work with ICISF Canada out of Alberta. So we have funding from the Humboldt Broncos Charitable Foundation to help provide training and develop a program in resilience and well-being. And so there's a number of different things that we're bringing forward here in the next year because we've established a relationship and a reputation within the province for the integrity of the programs that we have. So,
wow, that's incredible. So can you provide examples of situations where peer support quote unquote network has been beneficial to healthcare and public safety personnel in your province?
Mhm. Sure. Well, I can go back to the Humboldt Broncos situation, just to highlight it because it was an extraordinary event, but an extraordinary effort by an awful lot of really good folks trying to help. And so, over the about 5 years prior to that, there were organizations within health that had been asking for training. And so I'd done some training with emergency department teams. Fortunately, one of the teams that I trained was affiliated with the emergency department in the hospital that received the 14 injured hockey players and team members. And so they had some resources there. It was still overwhelming, though, because many of their team members were also involved in the response. In the communities where this happened, the accident was actually 130 kilometers away from the community of Humboldt. It was in a rural area, so there were a number of rural volunteer fire departments and EMS teams and privately owned and health and provincially owned ambulance services, plus helicopter and fixed wing transports. All of those different agencies, some having teams, some not having teams, volunteer fire departments, some having access to support, others not having that knowledge of support. And so we became involved very quickly and were in the area where the accident happened. But 130 kilometers down the road was the community of Humboldt, which was not part of the scene, but was very much affected by the loss and by the incident itself. And so in their community, there were school students because the boys that were on this team went to the school there in Humboldt. The community members did, up here in Canada, we do billeting. So teams are moved around, team members are moved around, and they live with someone. They live in a family home when they play hockey in this way. And so all kinds of different levels of groups were affected. Tons of people, hundreds of people were affected. And we actually provided resources for the groups that were involved on the scene, but then began getting calls for other groups along the way. And it was definitely the most incredible response between mental health professionals who stepped up and provided resources and support, between the teams that were existing, that were available. And we tried to gather as many as we could to bring in the right resources and provide the support on the scene, because we know if we can get in there very quickly, we can help affect change very rapidly and help people through that initial bump. And so the organization wasn't in place at that point, but it was certainly a time where I kept getting calls saying, do you know someone who can do this? Or is there an organization that can help with that group? And so we realized right then, this is what we need to do with our network. But beyond that, so many people who were trained stepped in. So many organizations that had teams stepped in. Regina Police Service actually did some interventions for another junior hockey team. We had resources in each community, and we're constantly in touch with the community of Humboldt because the fire chief there is also on our board of directors, and he's also CISM trained. And so there is a large network of people, individuals in our province that have this training, but there wasn't a way at that point to just bring them all together unless you knew who they were. And so now we have that. Now we have those groups work in a collaborative effort. We actually sometimes do multi-agency debriefings in rural areas. It's not something that we see in municipal settings. In fact, agencies are never forced to do that, but sometimes in the rural areas, the lines are grayed between who's doing C-spine control and who's managing a scene situation on the other end of this. So in rural settings, people who work in rural settings will understand this. And so we have found that in all of these settings, we've been able to make adjustments to how we respond in order to be able to provide the very best that we can. And in that time, we always say when we're doing the strategic planning that you plan for the worst and prepare for the worst, and you'll manage everything else. And I think that we have had what some would say was the worst ever. and we managed through it and learned a great deal and identified the lessons and then addressed them. And so I think that that's how the network was created. And we have a lot of really great people helping to build this now.
Well, I think it's incredible to hear that your particular network has a bunch of individuals and teams that really stepped up and took the reins and assisted, the community during a time when it was needed most.
Mhm.
I think that that's very encouraging and definitely definitely exciting for a network because not every network is like that. So I think that's what makes your network especially unique.
Mhm.
So what sort of recommendations or tips can you provide to organizations, CISM or peer support teams, or even agencies about filling the gaps within peer support?
I think first of all, establish your standard of care and training, making sure that what you provide is the best, the most evidence-based strategy and models and the work that you do. You need to be doing the best standard that you can, be offering that best standard. The other thing that I think is important too, once you adopt that and that's your goal, you need to decide how you're going to develop a sustainable program. So, for example, with the network, we have provided training for instructors, and then they in turn come back and help us train more teams. And
Mhm.
those trainers are mentored. I've been doing this for quite a long time, and so I'll participate in the class and provide a little bit of the training, but be there more as a resource than anything to make sure that our new instructors, our new ICSF instructors, are confident in the work that they do and feel really well versed in the curriculum so that they're confident in front of the classroom. And what that does is boost the capacity for many people also to become part of a team. So that's the first thing. The second thing that I really encourage you to do is look around. Look around. Don't become too focused on exactly we need to do this and that's it. Always have someone, it's like in your incident command system or in your when you're on site where you've got someone who's a safety officer. Always have someone looking at the big picture. And every so often get together and say, are we doing what we want to do? Has our focus changed? How can we adapt to the need? Is there a need here that we weren't aware of? So truly be flexible and look at what you can provide, but also realize that you can't do everything for everyone. And so for us, bringing in therapists to help us develop some of the programs, adopting some of the training that comes in through the ICSF online. We just completed the first of a number of trainings in resilience and well-being. We have instructors that are going to be completing the psychological body armor course, and they'll be able to do that training within our province. We also have attended just recently Glenn Schiraldi's class on resilience training, and so we'll be doing that again in January. And so part of our mission too is to provide training within the province that we can, but have a breadth enough of the different training skills in the curriculum so that we can offer a variety of things internally as well as being able to reach out and do things externally. And I think the other part of that too is to recognize within your province or your state or your city what you can do and what you can't do. Know where the boundaries are, but also understand that occasionally you can reach out and there's that extra support someplace where you may not have expected it. We have a really great relationship with the Saskatoon Fire Department. And
Mhm.
all I do, I don't contact their team, their CISM team, I contact their chief and he takes care of it. And it's because in these larger settings too, there's union negotiations and then there's the management level. And so when we understand where the decision making is, we want to make sure that we do this in a way that builds relationships rather than creates problems and creates obstacles. And so those are some of the things that we've noticed. And I think the other thing too is always be prepared to defend the model,
Mm.
because there are still folks that read that Cochrane review in 2003 and kind of put that aside and said, well, that's the end of that. And we know now that there is so much that we do that is evidence-based, that is based on the research that's being done currently. In the last few years, there's been so much that has come to the forefront to really verify the effectiveness of the work that we do. That when you build your teams, you build it with mental health support as well as peers, and decide what skill sets they're going to use and then how to do that. So there's a great deal that I think it goes into building the program. But as you get those objectives in place, have a long-term and a short-term goal set for what you're going to do. What do we need to accomplish this year? How about 5 years down the line? How do we want to look at that point? So truly look at sustainability of your programs too.
That's incredible. Those are all wonderful tips. Thank you so much for sharing.
You're welcome.
Oh my goodness. Well, if you guys have enjoyed our discussion today and would like to learn more about filling the gaps in peer support, Patty Stewart McCord has actually put together a helpful PDF with some tips. Feel free to download and share with your coworkers and peers. You can actually find the link in the description below. The ICISF app also offers a variety of peer support resources for individuals and CISM or peer support teams. You can purchase the digital ICISF quick reference cards, a CISM step-by-step guide, the Secrets of Psychological Body Armor resource, and even self-care resources. To learn more about these resources today, you can visit our app at app.ici, S as in Sam, F as in Frank.org. Are you guys looking for additional peer support resources? To learn more and read articles about peer support on our website, you can actually visit our resources page. We offer free handouts on peer and staff support and even self-assessments. You can learn more by clicking the link in the description below. And we even have more great resources. Another great resource is the free access journal, Crisis, Stress, and Human Resilience. We have many articles through the journal that discuss peer support and would be beneficial to any individual, CISM team, or organization. You can learn more by visiting crisisjournal.org and read all of the articles there. I'd like to thank Patty for joining me today to discuss filling the gaps in peer support. All of these tips and different resources that you've provided and talked about today have been instrumental, and I just want to say thank you.
You're very welcome. Thank you so much. Thank you very much.
And again, if any of our viewers have liked today's discussion, make sure to give this video a thumbs up, and we'll see you all next time.
Bye-bye. Take care.